Florence Nightingale, the woman that changed nursing forever. The year was 1820. In the beautiful city of Florence, Italy, a baby girl was born into a wealthy British family. Her parents named her Florence Nightingale, after the city where she was born. Florence grew up surrounded by comfort and luxury. Most girls from rich families were expected to marry, host parties, and live quiet lives. But Florence wanted something very different. From a young age, she believed God had given her a special purpose, to help people who were sick and suffering. Her family strongly disagreed.
There must be more to life
They believed
than this.
nursing was dirty work, meant only for poor
I have
women.
made my decision.
But Florence
I will
refused
pursue
to give
nursing,
up.
regardless
She
of your
secretly
objections.
studied medicine,
This is
hygiene,
scandalous,
and
Florence.
patient
It is
care.
unacceptable.
Eventually, she traveled to Germany to train as a nurse. When she returned to England, she became known for her intelligence
There must
and
be
dedication.
more to life than this.
In 1854, war broke out between Britain, France, and Russia. It became known as the Crimean War. Thousands of British soldiers were injured, but many were dying not from their wounds,
We are going to
but
get
from
you clean
dirty
and
hospitals,
comfortable.
infected water, and terrible living conditions. When the British government asked for help, Florence accepted immediately. She arrived at the military hospital in Scutari, in present-day Turkey, with a team of nurses. The sight shocked her. The hospital was filthy. There were rats, overflowing sewage, and not enough clean beds or fresh water. Soldiers lay on the floor in pain with little food or medical care. Florence knew the first battle was not against
We are
disease.
going to get you clean and
It was
comfortable.
against dirt. She ordered the hospital to be cleaned from top to bottom. Windows were open for fresh air. Clothes and bedding were washed. Clean water and healthy meals were provided. She organized supplies and improved patient records. Every night after the doctors had finished their work, Florence walked through the dark hospital halls carrying a small oil lamp. She stopped beside each wounded soldier, comforting them with kind words and checking on their condition. The soldiers admired her deeply.
We are going to get you
They
clean
called her
and
the
comfortable.
lady with the lamp. As the hospital became cleaner, the number of deaths dropped dramatically. Florence proved that good hygiene, proper nursing, and careful organization could save thousands of lives. After the war, she returned to Britain as a national hero. But instead of enjoying fame, she continued working to improve healthcare. She used facts and statistics to convince the government to reform hospitals. She wrote the famous book, Notes on Nursing,
We are going to get you
which
clean
became
and
one of the
comfortable.
world's most important nursing guides. In 1860, she helped establish the Nightingale Training School for Nurses at St. Thomas Hospital in London.
There must be more
The
to
school
life
trained
than this.
professional nurses who spread her methods across the world. Even though illness kept her in bed for many years later in life, Florence never stopped writing, advising hospitals, and improving healthcare. In 1907, she became the first woman to receive the Order of Merit, one of Britain's highest honors. Florence Nightingale passed away peacefully in 1910 at the age of 90.
There must be more
Today,
to life
she is
than
remembered
this.
as the founder of modern nursing. Her compassion, courage, and belief that cleanliness and proper care save lives changed medicine forever. Her lamp may have gone out long ago, but the light she brought to healthcare still shines around the world. Don't forget to like, comment, and subscribe to Tales by Jumy for more amazing historical stories.